So good afternoon, everybody, and welcome. Thank you so much for joining us on a rainy, stormy, and depending on where you are, potentially snowy day. Although some of our panelists are joining us from Ontario, and I'm grateful to them. And apparently over there it is sunny and not stormy at all. So it's always nice to be reminded that if we are experiencing a storm, it's not permanent. And there are other possibilities ahead of us. So I want to thank you all for joining our Big Ideas in Mental Health, which is a series that our Social Justice Committee organizes. And today we are going to be focused on issues related to social justice and gender diversity. So I want to thank you all for being with us. And I would like to begin by acknowledging that I am speaking from Mi'kma'ki, and indeed the Nova Scotia College of Social Workers is in Mi'kma'ki, which is the ancestral and unceded territory of the Mi'kmaq, whose inherent rights were recognized in the peace and friendship treaties that were signed from 1725 to 1779. This series of treaties did not surrender Indigenous land, resources, or sovereignty to the British Empire, but instead established rules for an ongoing relationship between nations. The treaties were later reaffirmed by Canada in Section 35 of the Constitution Act 1982, and they remain active to this day. The Nova Scotia College of Social Workers joins our members and our communities in the necessary labor of reconciliation. We are grateful to live and work together as treaty people in Mi'kma'ki. Please think of the lands, territories, and Indigenous peoples who lived and continue to live within these lands, and how each of us, individually and as a collective body of social workers, can hold ourselves accountable to reconciliation with Indigenous peoples here and across Turtle Island. We are all treaty peoples. Ulalu. Thank you all. And today, this panel was organized because, in part, we wanted to honor on Saturday, Trans Day of Remembrance. We wanted to remember and honor all those who were killed, who died as a result of transphobia. And in fact, the statistics suggest that this past year was the most violent on record yet. So I do want to invite us to take a few moments right now to pause and have a moment of silence as we remember those whose lives were lost as a result of transphobia. Let us commit ourselves to honoring their memories by working for advocacy, education, justice, awareness, so that this world will one day soon be free from all of the negativity and hatred that may have impacted them. I want to take a special moment to thank our panelists who will be joining us today and who will be speaking in this order. Debbie Owusu-Akyeeah, who is the Executive Director of the Canadian Centre for Gender and Sexual Diversity. Garry Dart, PrideHealth Coordinator. Chris Cochrane, trans activist and educator. Stel Raven, the social worker. Dylan Thompson, who's a gender-affirming care advocate and a transfeminist. Fatima Rasti, who's also a social worker. Jordan Sullivan, who's a who works with the Community-Based Learning Center with two-spirit, lesbian, gay, bisexual, transgender, queer plus individuals, survivors of conversion therapy, and is the support project coordinator. as well as Lisa Lachance, who is MLA for Halifax Citadel Sable Island. Grateful to each of you. I apologize for potentially mispronouncing some of your names or where you all work, but know that I am profoundly grateful to each of you. Our questions for today is, what are the unique social justice issues facing gender diverse individuals? And how can these impact their mental health? And what should social workers know when working with them? As well as what recommendations you might make regarding areas for policy advocacy to address these issues, and advice for social workers and others who want to help. So we've got 2 questions, which means that we are going to be going through, all of our panelists are going to be sharing their answers or perspectives about these questions or their own experiences that are related. And I will also have the opportunity to have a variety of different questions from the chat. So anyone who has questions, we will open it up to our panelists afterwards. My hope that this is just the beginning of a much larger conversation. So I want to thank you all for being here. And with that, I am going to invite first Debbie to speak with us and share a little bit of perspective on this first question about the unique social justice issues facing gender diverse individuals. Debbie?
Thank you so much for having me, everyone. I'm very grateful to be here. I'm calling in from the unceded and unsurrendered territory of the Algonquin Anishinaabe, which is also known as Ottawa. I like this question, and I kind of want to preface and maybe complex the question a little bit by recognizing that there isn't one unique social justice issue that's impacting gender diverse people. For many, they're facing multiple at the same time, whether this is accessing affirmative or affirming healthcare to having to navigate what is systemic, often militarized police brutality. Gender diverse people are trying to survive in a world that is very, very, very confrontational in almost reminding them every day that their existence is meaningless. And I mean, with the way in which transphobia and homophobia and other forms of systemic oppression manifest in our communities and our societies. We're often dealing also with power, and I use power in an abstract sense, but this could also be elected officials, both at the municipal level, provincial, or federal. We're dealing with power who often likes to tell these same people that they should be grateful for the small policy wins that were achieved, which are really well fought, but often don't speak to these complex issues. And I often hear this a lot of the time about gay marriage, and oh, you folks should be happy about gay marriage. Isn't that enough? No, there's a lot more than that. And simply saying that that should be all we should deal with, it totally ignores the fact that these complex issues are what people have to deal with on an ongoing and daily basis, and where it impacts them on their mental health, and especially for 2SLGBTQ youth, who I work with a lot, is that they often are dealing with a bombardment of this messaging in media, in schools, in their day-to-day communities, and it impacts their sense of safety. And having to navigate that on an ongoing basis is going to impact your mental health immensely. And so for social workers or folks who work in social work fields or care fields very similar to this, it's important to recognize that the issues that impact these communities are complex. And these complex issues are going to manifest differently for individual queer and trans people who you might be dealing with on a daily basis, weekly, et cetera. So you need to recognize if you prescribed a certain intervention for one person, it's not going to look the exact same for the next person. And that's super important to remember. An additional thing too, professional development opportunities or learning opportunities, they just don't end with like one workshop on LGBTQ inclusion for you to get it. And I think this is a message for both social workers who are LGBTQ and those who aren't. Because sometimes even people who are within the community need that reminder when we are in positions of care and power. It also doesn't end with this particular panel. It's going to require an ongoing commitment to learning how these complex issues impact the communities that you're dealing with. And then you also need to remember that like those individuals in whom you are providing care for are best equipped to let you know how you can assist them. From a public policy perspective, I like to think that all of these issues that I mentioned, how they manifest, how homophobia and transphobia still exist in our communities, impacting the safety of people, these are all public policy failures. Therefore, they're going to require complex public policy interventions in order to be fixed. Our organization released an LGBTQ action plan report in May in the hopes that it would influence the federal government's LGBTQ action plan. And one policy recommendation that we mentioned that was very fitting is that we asked for increased 2SLGBTQIA healthcare services and mental health spaces that are free and subsidized. We want to see that, but these connect to so many other issues. You know, we want to see hopefully a standard amendment in our National Healthcare Act that will see trans-affirming healthcare across every single province and territory in this country. To conclude, because I know I don't have a lot of time, I want to mention that social workers play a very important role in long-term cultural change that improve the lives of queer and trans people, and in policy change. Oftentimes they absolutely inform each other. If you are someone who's looking for ongoing learning, seek out the leadership of queer and trans activists. Trust me, they're in your own communities, and amplify their calls for policy change, because trust me, they're doing it. You have the power to influence the spaces that you're in, especially if decision makers and power are providing you a listening ear. Use that as an opportunity to amplify those messages from queer and trans people when it comes to addressing their own mental health issues and other issues regarding violence and care. And I think it's just a good reminder of like, you have that responsibility to show up for these communities. So if you can do it, please take advantage of it. So that's all I have to say today. Thank you so much for having me.
Thank you so very much. And Garry, I invite you to unmute and share a little bit. We have a wide variety of different speakers. Some are speaking from a first voice perspective. Some are speaking as providers within the community, and some from a advocacy perspective. So I'm just grateful for all of your perspectives. Garry?
Yeah, thank you so much. And thank you, Debbie, for starting us off. I mean, that was incredible. Yeah, I'm very privileged to do the work that I do at PrideHealth. So I am speaking a bit on behalf of PrideHealth, but also as somebody with lived experience as a non-binary person that has worked many different places in many different parts of this country, and has been an active activist for many, many years. And I can see many of the other panelists I've met you, or at least heard of you, and the incredible things that you all do. So I really appreciate the group that's here today. I think when it comes to healthcare, I mean, there are just so, I was really trying to figure out how to address this within a couple of minutes, because it's such a complex issue, and what perspective did I want to take? And I think, the barriers that we currently have in accessing, in particular, trans healthcare and affirming healthcare for gender diverse folks is just wild. And I can tell you that from a work point of view. I am currently the only person that works at PrideHealth. I am a 0.8 position and have been filling in for our navigator, which is a half-time position, for 7 months as well, unofficially. So I am the only representative within Nova Scotia Health and the IWK for queer and trans folks across the board. If that doesn't show you what systemic oppression is towards 2SLGBTQIA folks, I don't know what will. That's the way that's the priority that we are within the health system itself. And then when it comes to actually accessing healthcare, we know that there are extreme barriers, particularly the letters that are required for gender-affirming surgeries and for hormones. Why do we need a specialist letter? We don't need it or require it for anything else. And there are so many providers, particular mental health providers, that either refuse or don't want to, or don't feel like they have enough education to write those letters that are currently required. So even the fact that we need the letters, and then people that can provide those letters and should be providing those letters, because every single social worker should be providing those letters, you know, it's just another barrier, another gatekeeping measure. And it's in these periods of people trying to access healthcare and then waiting 2 years to get a surgery, you know, and going through all of those hoops, that people have the worst gender dysphoria, the worst mental health when it comes to depression and anxiety, and suicidality. And that's when we're losing folks. It is the systemic oppression and discrimination and gatekeeping that is, you know, it's killing our trans folks. You know, we talk about Transgender Day of Remembrance and you know, people being murdered. Yes, that happens, but this is also massive ways that our own folks are dying. And I really don't think the system understands or addresses it in any significant manner. And often we are tolerated, or we're labeled the angry queer person, or the, you know, angry person of color, because we are the people that are using our voice and we know our power within the community and we are saying something about it. And that's how the system doesn't want to listen to us often, or tries to oppress our voice, or say that, you know, oh, well, we can't, you know, rock the boat within the system. We have to go with the system. No. If that's what your college is telling you, if you're all social workers, many of you are social workers, mental health workers, push back against the system, rock the boat. If you want my support, please call me up. I will come in. I have a loud voice. I'm an Irish Newfoundlander with ADHD and I'm a Leo. I will bring that energy to you. And imagine that caffeinated. I'm only drinking green tea. So please, please, please invite me in, and I will use my voice along with your voices, along with your actionable voices, to make systemic change, because that's where we're going to see things. We need policy change on the college level. From, you know, higher level, we need ELT, SLT, and the CEO making those changes. It can't be singular voices at the bottom. We need positions of power to make those choices and to make those changes. And so I advocate for all of you to use your voices, because you have the power to make those changes within the systems that we work and live and exist. Thank you.
Thank you so much. And that is exactly why the Nova Scotia College of Social Workers signed on to the gender-affirming care policy, because we want to advocate and move towards social justice soon and speedily. I want to now ask Chris to unmute and share a little bit her perspective.
Hello, everybody. My name is Chris. My day job, I work for the Youth Project. I'm the support service educator. So I actually work one-on-one with 2SLGBT youth, and I also work with their parents schools. I also do education within corporate companies, basically anybody who wants to get healthcare. But I'm also going to come from a personal perspective. I'm a Black trans woman. As it's been stated before by many others, that Black trans women are disproportionately unalived more than anybody in our community. And unfortunately, we have people without our inside of our community and outside of our community. So we're in this hateful stance where everybody's kind of pushing against us. I like to say in Nova Scotia, we have this thing called polite ignorance, where we like to pretend we don't have homophobia, transophobia, or racism. So therefore, if we don't have it, we don't have to fix it because it's not a problem. If we're not fixing it, then we're having systemic problems where it's just going to keep going on and on and on and on. And we still have very much a Nova Scotian old way of thinking when it comes to medical procedures. One of the things that trans people have to deal with is dysphoria, but unfortunately, the medical professions usually focus only on the dysphoria when it comes to transcripts, when we have to get letters, when we have to do physical therapy, when we have to do mental therapy. They focus on that and not thinking of the euphoric side of the things, therefore only demonizing it, making it hard for people. As somebody who has went through the process of having my surgery and getting my hormones. It took me 6 years for me to get through all of the paperwork and all of the sessions. And the only reason I got on to get my surgery in 2018 is because there was a cancellation and I got it last minute. There is so many problems with that because there's people that are basically waiting out the clock, and sometimes they don't get the time. They don't have the time within themselves. So therefore they're either sidestepping medical procedures and leaving the country, or they're sidestepping procedures and not getting them done, or they're just sidestepping life. They're not getting the procedures that they need. And here in Nova Scotia, we already have a horrible doctor shortage. Then that's for the average citizen. So for somebody who is in a community, inside of a community, inside of another community, it's even harder for those people to get it. And also as trans youth, as someone who speaks with trans youth, they're closed off as it is. Youth are, if you ask a youth directly a question, they're going to go every which way, or they're just not going to answer you. It's the same thing with trans youth, except for it's even more. So therefore, it's harder to get to them because they don't see themselves represented. They don't see themselves having the power to do so. With all of this, it just boils down to that we're not doing enough. I just did a discussion last week for volunteers, and I say to myself every time I enter a panel, every time I enter a discussion, every time I enter anything, I start counting the people of color. And then I start counting the queer people within there. And then I try to do that intersectionality of such. And sometimes I am standing in that room as the only person that is intersexing, or somebody that's completely from that community. So it's not only a systemic problem where we're not getting the care, but we're also not having the representation of the people within our community. The amount of times that I've had to explain myself to white cis men that had no care and basically just wanted to check me off and get me out of the door is beyond. We are sexualized as trans women and trans women of color. We are sexualized within the community itself, and then also in the medical profession. As social workers, you work kind of, as that interperson between all of these things. So therefore, you have to make sure that you are not only focusing on the aspect of, is this person getting enough care, but is the person that is giving the care also representative, and also understanding, and also being able to give the direct care without harming the person. Because unfortunately, sometimes there's so much harm done to our community, to us, just to get a simple thing, as Garry stated, just to get, have a surgery or to get hormones. We have to go through this rigorous transformation of ourselves, pun intended. We have to basically go by a gold standard of what it is to be a trans person, or what it is to be yourself, looking the part and acting the part, which does not make any sense to me. I just want to make sure that people understand that, yeah, it's a problem and we're all fighting against it and it's great. But your queerness or your racializedness does not counterculture other people. So if you're a white cis gay man, does not mean that you have the same plight of a Black trans woman. And sometimes you have to understand your privilege, understand where you come from. I know I'm a light skinned cis presenting Black trans woman, so I have it a lot better than my counterparts who are dark skinned trans people, or as some people like to say, non-passing or cis presenting. They have it a lot harder than I do. But my stance is to make sure that I get my foot in the door, that if we don't have a seat at the table, to make that seat available, and if so, put a leaf in it. So therefore we take up even more seats and make sure that we understand that we're not going anywhere. We've always been here. The only difference is now we have representation. And as Garry, I am also a Cape Bretoner. And a loud, very, very loud Cape Bretoner. And I don't mind being the angry Black woman if it gets the job done. So we have to understand that there's people that are willing to fight for us, but we have to make sure that we're giving those voices. And also, one last thing is make sure that you're speaking up for the voices and not speaking for the voices, because some people within our community and some people within our organizations like to speak for the person as opposed to speaking up and elevating the voices. Elevate your voice, listen to what people say, educate yourself, and make sure that you're educating everyone around you at all times.
Amen. I am so glad this has been recorded, because I hope that anyone who's watching pauses and rewinds and listens to that like 12 more times at least. Thank you so very much. I am now going to invite Stel, and I'm just looking. Oh, there it is. So I'm going to.
Hey,
Stel.
thank you. I'm feeling really honored to be on this panel. I am a two-spirit queer and trans person. I am also a social worker who works in private practice because I couldn't continue to work with within agencies. And as I was looking at these questions, trying to think about what within 3 minutes, how to condense this topic that could be non-ending, unfortunately, I too really thought about access to healthcare and how difficult it is for us as trans people to access healthcare and multiple forms of healthcare, whether I'm trying to access, getting a cast on my arm, or if I'm trying to access trans-related healthcare. Across the board, there are a lot of barriers that end up coming up to accessing of surgery, to accessing of services and surgery as well, if that's what's desired. And I think one of the things that I really want to highlight is that we have to understand that this is more than just these barriers impact us as trans people on a very deep level, and impacts our mental health that then create barriers to accessing services. Even before we access services, we're constantly needing to assess and reassess and check in with community members of, oh, I have this appointment with this neurologist. What has been your experience with this neurologist as a trans person? Whether you're quote unquote passing or not, that is still a significant part of our lived experience, and that needs to be really highlighted. But in my time, I have the clock going. All right, I'm gonna try to speak a little bit quicker. What I really wanted to emphasize during this very short panel is, as social workers, our duty to operate through informed consent. So the barrier has already been brought up of the requirement of getting letters for us to access medical transition related care for hormones and surgeries. And number one, as far as policy goes, though those requirements need to be thrown out the window. And we have to really start pushing on a policy level as well with WPATH, which I know some of that is happening, but it needs to be happening harder, stronger, louder, that the WPATH standards of care that everybody who is writing a letter needs to work through. They're written through a very colonial lens, through a very colonial perspective of what gender is and what its requirement is. As social workers, we have a code of ethics, and our code of ethics states that we are required ethically to pursue social justice, and we are also required ethically to support self-determination. And those two things together mean that as social workers, we ethically are obligated, if we are writing these letters, they should always be written through an informed consent model. And what I mean by informed consent is walking away from a assessment lens of sometimes these letters are referred to as gender assessments or readiness assessments. And I think even that language is absurd. How do you assess someone's gender? We need to step outside of that and step into, as social workers, a consultation model. You do not need to understand my gender, my experiences with gender, to write me a letter to say I can access the healthcare that I require. In fact, you probably won't understand what my experiences are with gender, because gender is something that is not linear for anyone. It is really hard to articulate within the English language, and the viewpoints, how the WPATH standards of care have taken gender and squish them into these categories is absurd, and is not something that is not a process that would ever be done for folks who are considered cis. So how we've been able to take it and then place it on folks who do not easily navigate the world within the gender binary, to me, is just absolutely absurd. So we need to get rid of the letters. If we are writing letters, anybody who has a master of social work in any province is allowed, I use that word very loosely, to write letters. You should be saying, yes, I can write this letter. Yes, I will. And if you do not have the required. If you don't feel comfortable, I think it is absolutely on you to get more comfortable and get comfortable through an informed consent model, through a consultation model, and push that also on your colleagues. You as social workers who are not trans need to be advocating as well, because when it's just put back on us who are within the system and are trans people, it's just exhausting at the end of the day. It's really exhausting, and we need lots of people pushing for these changes. I'll end there.
Thank you so much. Really appreciate that. I am now going to invite Dylan to unmute and share a little bit of her perspective.
Hi, thank you, Nadia. And thank you for being such a great partner, first of all, in our advocacy work to improve gender-affirming care in Nova Scotia and make us a world leader, because we really shouldn't settle for the international standard. We really should be setting the standard, because the international standard right now, unfortunately, is transphobia. And also, and this is a phenomenon I will be talking from a trans feminist perspective, the standard is also trans misogyny. And I believe it is important to name systems of oppression, or it's really difficult to challenge them. So I will be using that word, and it's often not used within or outside of queer spaces, but trans misogyny is real, unfortunately, and it plays itself out in many ugly ways. I will first of all, like, the mainstream debate, in the media has been framed like feminism versus trans people. I think that's a bit of a misunderstanding. Feminism really needs trans people, especially trans feminine people, and trans people definitely need feminism. So what is trans misogyny, first of all, and how does it play itself out systemically in gender-affirming care? So in our misogynistic culture, things that are deemed feminine are often coded as artificial, frivolous, and contrived. And in our cis-sexist culture, cisgender people are just seen as inherently more natural than trans people. You put those two belief systems together, and in the case of gender-affirming care, feminizing procedures for trans feminine people are just seen as inherently more cosmetic than other procedures. And this does play itself out in our legislation. And I will give you an example, a concrete example of this. So in the first round of procedures that were covered by the government about a decade ago now, top surgeries were covered for trans men, but not for trans women. They were deemed cosmetic under any circumstance. In 2017, a trans woman filed a human rights complaint saying that this is discriminatory, and it was. The government's initial response was, well, we're being reasonable because hormones can add breast tissue, but hormones cannot take away breast tissue. Well, I would argue hormones can add facial hair, but hormones cannot take away facial hair. And the government currently does not cover hair removal. I am paying out of pocket for hair removal. So the common denominator really isn't what hormones can and can't do. The common denominator is this benefits trans women, and we don't do that in this province. That's discrimination, and that's wrong. 2 years later, the Human Rights Tribunal agreed, and they mandated the government needs to start covering top surgery for trans women. But rather than just covering top surgery for trans women, like it's done for trans men, and by the way, I do not have an issue for that. I support trans rights, and trans men have every right to access this life-saving procedure. Rather than just wholeheartedly granting access to this life-saving procedure to trans women, the government implemented a highly restrictive system called the Tanner scale, which is it's an inappropriate measure. It's used to measure typical development for adolescents, cisgender adolescents. There's medical evidence this is inappropriate to apply to transgender people. And the government, again, said they're being reasonable because this is the standard they apply to cis women seeking breast augmentation. Well, the government doesn't offer mastectomies to cis men under any circumstance, but they do to trans men, and that is absolutely reasonable. The government is willing to make a cis-trans distinction when it comes to access to gender-affirming care, which is completely reasonable because only trans and gender diverse people access gender-affirming care, but they are not willing to make that same distinction for trans women. So there is a trans misogynistic double standard baked into the law right now. And unfortunately, that is the standard across Canada. Either top surgery is denied to trans women or it's severely restricted. And unfortunately, and I am unapologetically speaking from a trans feminine and trans feminist perspective, and I'm doing this because trans misogyny exists everywhere. It exists outside of queer spaces, and it definitely also exists inside queer spaces. And this plays out in who gets to hold leadership positions in trans and queer organizations. There are very few trans women and trans feminine people in leadership positions, and that does affect how trans misogyny is addressed. So I'm just going to end on this thought. Let's take a moment to acknowledge the #1 killer of trans people in Nova Scotia. It's not the transphobic parent who disowns their child after they come out as transgender. And it's not the transphobic business owner who denies trans people secure employment, relegating them to a life of poverty. It's not even the cis man who all too often murders trans women in trans misogynistic rage. None of these individuals are the #1 killers of trans people, although they and many others directly and indirectly kill trans people. Instead, the #1 killer of trans people in Nova Scotia is the Nova Scotia government for denying trans people access to the life-saving care that they, like every other Nova Scotian, deserves. And how can social workers help challenge trans misogyny? I guess name it when you see it. Educate yourself on the topic. The Whipping Girl, lovely book, and there's other trans feminist writing as well, and it's definitely useful for cis women and feminine people broadly. So I definitely recommend educating yourself on trans misogyny. I also recommend uplifting voices, as others have said. Uplift, empower trans feminine people. It'll make a difference. And definitely support our call to make Nova Scotia a world leader, not just on ending transphobic discrimination, transphobic medical discrimination, but also trans misogynistic medical discrimination. Thank you.
Thank you so very much. I know I said this when Chris spoke, but definitely rewind and watch a few times. And that's true for all of our speakers. And I'm grateful to each and every one, those that have spoken and those that have yet to speak. But Dylan, thank you so very much for sharing that important perspective. I'm going to now invite Fatima to unmute and share a little from her perspective.
Hello, everyone. My name is Fatima Rasti. I'm introducing myself. You can see my name. I work with IWK Health Center. I'm a clinical social worker there. And I'm also part of the trans health team doing harm awareness assessment. It's such an honor to be on this panel because I'm learning a lot. There are new terminologies, new point of views, which is really important for us to kind of like learn and open that dialogue too. So I totally thought totally different than how I'm going to present on this panel because there were questions, right? Just to guide our conversation, I think just our talk. So what I asked my question why it was important to for us as social workers to to discuss the unique social justice issues facing gender diverse individuals. First of all, I was very much impressed with presenting it as gender diverse individuals, which is really an umbrella terms. But then I was thinking, I mostly have worked with trans health, and we come across with gender diverse individuals, but seeing transgender people just struggling with the system, that's my area of most working with gender diverse population. So what comes to mind when this topic, you think about it, you think about social justice issues is exclusion and marginalization, bullying at school, they're rejected by families, pushed onto streets. I mean, we know all that, denied access to employment. But when it comes to gaps in the system, so that's something I'm really, as a healthcare worker too, and social worker working with these individuals who don't have access to, basic health. Not only that, so trans people are particularly vulnerable to these, even human rights violation when it comes to their name and their sex and details in official documents, because it does not match with their gender identity or expression, right? So there's gaps in service in legal system too. So legal gender recognition still a distant dream for many gender diverse, especially transgender individuals. So in terms of mental health, so that's something, because I work in mental health. So when I thought about, the mental health impact on their mental health, the big thing for me came up, stood up was gender dysphoria, right? People living with it. And then comorbidity with that is, other mental health problems like substance abuse, adjustment disorder, depression, anxiety, and suicide, right? So it impacts them so much, and I agree with Dylan that it's not, there's psychosocial stressors happening, there's discrimination happening in the society, but with suicide, there's stat report supporting it that, they're Canadian youth, trans youth, they're almost 66%. They're, they reported poor or only fair mental health. There was a survey there actually, which was done by Canadian Trans Youth Survey, and 33% attempted suicide in the 12 when they did the survey. So all these, as a social workers, what our what our role is, how we incorporate our standard of practice, which is self-determination. We make sure that the person they are having their basic human rights, and they have their self-determination, so they can use that their name, their preferred name, their pronoun. They have access to mental health, access to the employment and stuff like that, and then advocacy on our behalf, self-change in policies and procedures. So how can we help them with the legal name and pronoun on healthcare documents? So that process I have seen here at the IWK, because when people enter the mental health, because there's a stigma attached to that, it's so hard to enter a facility. First of all, accepting that help. They enter in the main area when their name is, because they're seeing on their legal documents, this is the person's name written in the documents, so they will be saying out loud in the when they try to register, and we're talking about people who are registering them. So that's been a challenge for trans youth to coming into the system and even opening up. So I have seen that journey here at the IWK, that even the main area staff, like the registration staff, they were all trained in that. They were given information, they were given tools to deal with it. So making it a regular procedure to ask everyone their preferred name and their preferred pronoun, and then entering that in the system where they can see it, So, and then giving that information to the clinician. So that's the person's given name and their pronoun, so they don't misgender them. So that was huge, that I have seen the journey, and we still have a long road in order to making, equal access to healthcare services, access to, hormones, and all the procedures needed in trans health. But we are on that road, and we need to be, gathering allies. We need to be, be there for, to be part of the, no matter who we are, but as social workers, because of, this is part of our profession to advocacy, right? So how can we be advocate on that, just going there and learning more. That's the other thing, because I'm a cis woman and coming from a very different culture. I had no information, or so when I, that was something I needed to learn myself. So I'm expanding myself in that area. So just, building that competency. And I don't like the word competency, but it's more like just getting information and equipping yourself with the knowledge and being part of those panels and webinars and equipping yourself what is available, and how can you be the agent of change in that journey.
Thank you so very much. And that is a great note to now invite Jordan to unmute and share.
Thank you, Nadia. Hello, I'm really honored to be invited to join this amazing group of panelists today. Really, thank you very much for the invitation. I'm a 61-year-old trans man with a master's degree in religious studies who transitioned when I was 51. I'm a survivor of religious-based trauma and conversion therapy that focused on my sexual orientation as a lesbian in my late 20s and early 30s. And I am privileged in that I could transition in my 50s with a supportive doctor and not having to rely upon financial assistance for surgeries. So I'm currently the project coordinator of the SOGIECE CT Survivor Support Project, which is based at the Community-Based Research Center. It's led by survivors, with survivors, for survivors. SOGIECE stands for Sexual Orientation and Gender Identity Expression Change Efforts, and CT stands for Conversion Therapy, which is now more commonly being referred to as conversion practices. And I will use these terms interchangeably when I speak. We define these terms as a broad set of practices that cause harm to LGBTQ two-spirit people through blatant or subtle pressures and messages to deny, suppress, or change our sexual orientation, gender identity, or gender expression. Most queer and trans people don't identify the pressures they faced to change their sexual orientation or deny their gender identity, whether experienced in religious or medical mental health settings. They don't identify that as conversion therapy. But like most people, when queer and trans people hear the terms conversion therapy, they think of the extreme experiences based in religious camps or programs. But whenever a trans or gender nonconforming person is harmed by pressures and messages to deny their gender identity or expression, they too are experiencing conversion practices. The early findings from the data that we've collected from April to September of this year shows that the majority of participants experienced leaving their faith community as the most important step towards healing, the time when recovery actually began. However, this option is not possible for trans people who experience conversion practices in the medical and mental health system. That system follows survivors in their medical records, which shows that they are all too often diagnosed with a mental illness, whether PTSD, anxiety, depression, or schizophrenia, rather than receiving the treatment that affirms their gender identity. Conversion therapy for trans people means dealing with non-affirming medical and mental health practitioners who deny them access to gender-affirming hormones, surgeries, therapy, and other healthcare needs. The goal of the SOGIECE CT Survivor Support Project is to create an advocacy plan, working with key stakeholders across Canada to develop the resources and supports that are needed to heal and recover from conversion practices. What recommendations do we have for research, for policy and advocacy to address these issues? We're just beginning to identify all those. But number one, believe it. Believe a person who says they are trans or gender nonconforming, and believe them when they say they've survived conversion therapy. We also need additional research. This project that I'm leading, people are telling me that it's the largest ever done amongst survivors, specifically focused on what supports are needed. We need additional research, particularly within cultural and cross-intersectional identities. We need increased education and awareness for everyone, including the LGBTQ community, about conversion practices and what they are, and helping people to self-identify. The medical and the mental health care systems need to be better informed about conversion practice. That includes psychiatrists, psychologists, social workers, other healthcare professionals who discriminate against LGBTQ two-spirit people, and conversion therapy survivors in numerous ways, such as misdiagnosis, homophobia, biphobia, transphobia, withholding transitional services, refusal of services, and alienation. Therapeutic practitioners who work to support survivors of conversion practices are urgently in need of support themselves. National and provincial mental health colleges and associations need to address the need for the development of treatment protocols, core competencies, and training, including trauma and religious trauma training for therapists who counsel survivors of conversion practices. Right now, there is no one anywhere who offers the necessary training on how to work with survivors of conversion practices. Conversion therapy bans are needed at every level of government, but they are only part of the solution, and they must include financial support for survivor initiatives. And that's just the beginning. Every experience of harm inflicted on a person who has been pressured to change or deny their sexual or gender identity is real and needs to be validated as trauma, as core identity-based torture, and as a denial of human rights. I hope you'll stay tuned to the CBRC website to learn more as the results of the project are made public early next year. And I will put some of the links into the chat so you can check that out. Thank you.
Thank you so very much. And stay tuned, because I am not done working with Jordan on how we at the Nova Scotia College of Social Workers can develop some of these standards for our social workers. And really, I'm hoping that all of the speakers who've contributed will continue to work with us in developing more education and resources for our members so that we can work to, as Dylan beautifully articulated, lead the nation in changing the standards for how all people get care, but especially those who have been and continue to be so profoundly impacted by the injustice of our current policies. And with that, I am super excited to have Lisa share a little about their perspective.
Great, thanks so much. It is great to be here, and what an amazing panel. So I'm probably going to stray a little bit from the topic of clinical practice. I'm not a social worker, but I do come to this talk tonight with a diversity of roles in terms of mental health. So I was a young carer for my mom. I've been a parent advocate for my children. I'm completing my PhD in health, looking at youth mental health services. And before I became the MLA for Halifax Little Sable Island, I was part of an organization called Wisdom to Action. And we have a history in community engagement, youth mental health, and working on lots of queer advocacy as well. And so in this past summer, I was elected as an MLA here in Nova Scotia. And so sort of from that perspective, I guess that I have some thoughts in terms of, you know, what it's like right now, like what the environment is like, and maybe where we can hope to see some progress along the way. So I think, as others have stated, I mean, really right now, people are accessing any kind of healthcare, including mental health care, including gender affirming care in a province that's in the middle of a health crisis. So, you know, mental health still has, you know, family practice often still plays, you know, like gatekeeper role to mental health services. So whether it's for your private insurance or, you know, in terms of getting referred through the public system. And as we talked about, there's also that gatekeeper role that continues to play out unnecessarily in terms of seeking gender affirming care. So I think it's really important just really to note that we're really in the middle of a healthcare crisis, and mental health, you know, has always been the second cousin, the left behind, you know, bit of our healthcare compared to physical health, and you know, since Medicare started, and you know, that's certainly been highlighted. I guess that I might say the jury is out for me at this point in terms of having a minister of addictions and mental health here in Nova Scotia. And I think having the chief officer role, which for those of you who don't know, has been created within the bureaucracy, I think that is really interesting. I'm never quite sure what I think of when you put stuff outside of the big system, like that it'll get more or less attention. So anyways, just to say that. You know, and I think as well, what's affecting the mental health of all of us really in this province, and so much around, you know, affordability, the housing crisis, inadequate wages. I mean, all of that has such an enormous impact on our mental well-being. And, you know, and then of course we know the stats around, you know, yeah, my cat is about to come visit. It's kind of distracting, but you know, we know the stats about, you know, employment participation, salary, and that sort of thing amongst a lot of trans and non-gender conforming folks. So, so I think that's really important to think about that whole context. And in terms of, you know, looking forward, so this current government talks about being committed to mental health, which that would be great. We'll welcome that. So far, the most concrete announcement has actually just been to expand service through private providers. So to add private providers into the billing codes in MSI, which may in fact be a good idea. But what it doesn't do is, I mean, essentially that's you know, an arm of healthcare that they're privatizing. So, and I think as well, so the research that I'm doing in my PhD program is on integrated youth services. And so I really think that taking into consideration all that's happening in our context and our environment, that, you know, obviously, you know, a monthly appointment with a therapist is probably not going to be sufficient in terms of helping people to a state of well-being overall. So I also know the Premier asked the federal government today for some money for community mental health clinics. And that sounds a little bit more like the work that I've been doing in my studies and with Wisdom to Action, looking at integrated youth services, which is a model that exists elsewhere in Canada. Our only spot is at Eskasoni, and I you know, these are they're youth programs. I actually think they can work for adults too. And I think some of their principles would really would be the beginning of supporting our community in terms of trans and gender non-conforming folks, because they have a real emphasis on being connected to the community, an emphasis on a commitment to anti-oppression. So I think those two initiatives serve we'll have to wait and see. I wanted to give a bit of a brief overview of some of the things that we are doing through the Nova Scotia NDP caucus and the type of thing that I've been doing in the House. Also, I'm obviously super new in this role, so just kind of learning how to do this gig, and really happy to hear people's input on what else I can do in this gig. So, as opposition, I've introduced a number of bills. They'll never get voted on. These are the private member bills, but they're the types of things that really bring forward, I guess, principles, right? So around implementation of the provincial components of the TRC calls to action, a mental health bill of rights, mental health emergency support, even things like a food secretariat, because of course, young people, particularly in schools, we have the highest child poverty rate. And again, thinking about this from an intersectional approach, that would really, how that affects people's access to healthcare. And then I think, the NDP obviously is talking a lot about housing, affordability, raising the minimum wage. So again, all those sort of building blocks, I think, to people's well-being. And, when I was coming into this role, I was really aware of the work that's being done around gender-affirming care that Dylan talked about, and as well, connecting with the folks in the Yukon who have done, implemented better gender-affirming care guidelines, as well as an action plan on 2SLGBTQ+ issues. So really wanting to know, wanting to be able to support people. I'm so sorry about my voice. It's like disappearing at this point, but support folks in terms of, I guess, what are our priorities? What are things that are political in nature? What are things that are can be dealt with other ways? And certainly hoping to see social workers on the front lines of all of that. So as advocates, as allies, as really giving voice to important principles around prevention and holistic approaches. And so I'll just quickly say before I can't speak anymore. So we did host an open forum last week, just trying to pull together people who are interested in talking about gender-affirming care and maybe other stuff. And I think we're going to keep providing support for that. And in no way does that, me saying that this is, I really see it as like creating some space for people and organizations in the province to have space, really. So if you'd like to be involved, you can find us really easily online. And we're going to hopefully have a second online meeting before Christmas. Thanks.
Thank you so very much. Definitely appreciate your perspective as well, and your work to advocate for also gender-affirming care on a policy level. Dylan, you had invited myself and probably several other organizations that are in attendance to work on supporting what Chris actually spoke beautifully about, which is the ways in which gender euphoria, as opposed to the pathologizing of gender dysphoria, should be a criteria amongst many other goals that we want to be advancing, so that we can ensure the best standards that are just and equitable for all people, and that don't reflect whether it's misogyny or whether it's transphobia or intersectionality or racism, that we can work on trying to advance this. I want to invite people, if there are any questions from the audience, to put them in the chat. I did ask our speakers to prepare for some closing remarks about any final words of advice for social workers or allies on either policy recommendations and advocacy, or just advice for social workers in general. It's entirely possible, since we have an amazing group of really brilliant people speaking from very different perspectives, that some of you have some thoughts about what you heard and would like to share some reflections as well on that. But first, I want to just give people a chance, if you have any questions, to write them in the chat. but I'm not seeing any, which I think means that people are busy checking all of the resources and web pages that have already been shared in the chat. So with that, I'm going to invite Debbie, who was our first speaker, to share some concluding words of advice for our social workers in general and anyone who wants to be advocating and working to help those needing not only gender affirming care, but just equity and justice in general.
Yeah, absolutely. And I believe I shared these in my opening remarks, but I'll just kind of quickly reiterate that being actively seeking out the leadership of 2SLGBTQ people to inform their advocacy work is super important. And it can be as simple as an investment in some of the most amazing grassroots organizing we're seeing, some at the local level. So for folks who are based in Halifax, I can guarantee you there's some activists who are doing some awesome work. I do want to shout out the Nova Scotia Youth Project, who is a youth-oriented organization that Chris works at, that is also doing some phenomenal work where you can actively seek that out and support it. And through that, kind of amplifying messaging that they might be providing on what local decision makers can be doing to improve their work. And thank goodness, unlike the town I'm in, wanting to have better representation at the provincial level. And so you have that with, luckily, fingers crossed, with Lisa, and there are probably other decision makers who can help it on the provincial level, but then also recognizing that there are national organizations who can amplify that at the federal level as well. And I want to reemphasize the point too, you will also have the ear of decision makers when it comes to specific social work oriented things. I know that the college particularly probably is also advocating on issues pertaining to social workers. That's an opportunity to also amplify that messaging while they're there, and don't hesitate to kind of sneak in that messaging with regards to affirming care for 2SLGBTQ people. You can do it. For some people, you're already doing it, and I think that's an important message to hear. You're doing that advocacy work already, I think, in being in this field. So keep going, keep doing it, and don't forget to center the leadership of the community in which you're serving.
Thank you so very much. I want to note that a question was posed about resources that speak to the intersections of ability or disability and trans health. So as questions pop up in the chat, if speakers would like to address any of those, that is also welcome. So Debbie, I'm going to just, before I remove your spotlight, give you a chance if there are any resources that you're aware of to either put them in the chat or share them now.
Absolutely. Let me give that one some thought, because I know that there's a lot of research that's been done, and so I can kind of drop some things in the chat if that's okay.
All right, and any other resources can be put in the chat as well. And bearing in mind that this is hopefully the beginning of a much larger conversation that we want to work with other organizations to develop as well. So all panelists and anyone who's aware of resources, please put them in the chat and specific to the disability and trans health as well. So with that, I am going to now invite Garry to share a few words of advice, concluding words of wisdom with us.
Yeah, first I really want to say thank you to all the panelists. I listen to people talk, and I'm part of the people talking about trans healthcare every single day for work and for the independent work that I do. But it's always so beautiful to hear members of my own community talk about the work that they're doing and be so passionate and incredible. And so, yeah, it's a really emotional topic, I think, for all of us. And I just want to say thank you so much for sharing, because it does take a lot out of us that do this work every single day. And I just want to make sure that you folks are self-compassionate, because you're doing such incredible work in so many areas of healthcare. And for the people that are wanting to learn more, there are so many resources. There are so many people like us folks here that you can support in the work that we're doing as we try and advocate for policy change, as we try and educate others as we try and do this work, and to continue doing that and to be actionable. It's no longer good enough to create spaces of, awareness, acceptance, tolerance. We need spaces of belonging, and we need to feel like we belong, and then move forward and be actionable on everything that we're talking about. And I'm glad that this conversation is about action. It's not about awareness, because I can tell you everything we talk about in the healthcare system is about awareness, and it's a hot mess. So I really appreciate you all, and I just wanted to say thank you, and make sure to take some time and take some self-care. Thank you.
Thank you so very much. Chris, I'm going to invite you to share a few words or final reflections, words of advice, call to action, all of the above.
So I actually work for the Halifax Youth Project. We also have another STEM of Us, which is in the South Shore of Nova Scotia, and we also have another one in Cape Breton. So we deal with all of Nova Scotia. We just have different staff in different areas. I just put our email in there, our website, because we have a lot of resources for 2SLGBT youth on there. We also do in-person programming and online programming. We also deal with a lot of disability justice. Our staff are constantly being trained for a disability justice. Everybody in the youth project in Halifax is under the trans umbrella, and we use our voices to uplift. But what I will say is, like I said before, education is a must. We have to make sure that we are not only educating ourselves, but the people that we're working under or working with. We have to make sure that everybody is doing their part. Even part, as me as a Black trans individual, does not mean that I know the plight of everyone. I use this term all the time, your body, your mind, your journey. And I believe that most people need to understand that it's not for anybody to tell you how to live your life except for yourself. Dysphoria and disclosure is a horrible thing that a lot of trans people have to go through. And I hope that one day we can have education in schools, not only for social workers, but also for doctors, anybody in the medical profession. So that way, when they're getting out into the real world, they know how to work within our communities. First, do no harm. So therefore, you have to make sure that you are well equipped for everything that you are going to encounter with our people. And we're not going anywhere, and we've always been here. The only difference is the visibility is different now. So therefore, that's why we're so in your face with it right now. And this whole, we need to wait our turn and wait in line. We don't wait in line. Our voices are loud, and they're always going to continue to be loud. So if you don't make a line for us, we're going to make another line, and then we're not going to add you to it. So make sure you understand yourself, make sure you're understanding your community. And again, like I said, speak up for people, but don't speak for people.
Thank you so much. And there's more resources that I see also in the chat, and hopefully people will continue. I want to invite Stel now to make a few closing remarks, reflections, call to advocacy, justice, action, learning, etc.
Thank you. So many things have come up over the last hour. And I think we're just hearing so much today. And I think this is a really good reflection of where we're at, that we need more than awareness. We need action. And I think in taking that action, speaking, like knowing who this panel is more directed to, assuming that the majority of you on this panel are social workers or in the field of social work, to really, for action, all of the things that everybody has already said, of like doing your place to raise the communities, like to create space and step back, know your place. And also, I think critical thinking really needs, like, learn how to think critically and use those skills to really challenge your own assumptions and biases on all levels, not just with, gender and gender identity and expression, but really, really push yourself when it comes to critical thinking. And the other piece that I really want to emphasize is that we know that doing nothing is not a neutral act. And someone in the comments, Emma, said ally is a verb. And I think that's really critical. So you need to think, if you're taking the stance of, I don't know enough, so I'm not going to do anything, you are actively causing harm. And if that makes you feel uncomfortable to hear right now, then I really invite you to lean into that discomfort and go, why am I feeling uncomfortable at this point? Because doing nothing is causing harm. Nothing is not neutral. So yeah, I'll end with that. Thank you.
Thank you so very much. And so now I want to invite Dylan to share some concluding words of wisdom, call to action.
Yeah, thank you. And yeah, I am being cognizant of the primary audience of this panel, which is social workers. So of course, one call to action, yeah, support our push to make Nova Scotia a world leader in gender-affirming care, clearly. But definitely, like, social workers do play a role with gender-affirming care right now, where they are often the first point of that trans people go to seek to get access to healthcare. That social workers do have the authority to write letters. And again, I'm going to talk about trans misogyny again, because this is the perspective I came here to talk through. Definitely, as a feminist, I oppose gender policing of any form. And as a feminist, I support people's bodily autonomy. I believe individuals are the #1 experts in their own lives. And definitely, I don't support rigid gender stereotypes. If you know me, I probably break quite a few stereotypes of what constitutes a trans woman. But this is a double bind that trans feminine people face. If they display a little bit too much femininity, they can get accused of upholding patriarchal gender systems. And if they behave a little bit too much on the masculine side, they can get accused of being a fake. Really, they're just trying to exist as they are. That's all we're doing. So I just ask social workers to keep that in mind as they assess trans people. We're just trying to exist. We're not trying to uphold some system. The system is also hurting us. So I'll leave it at that.
Thank you so very much. Fatima, I invite you now to share some final words of wisdom and call to action.
Yeah, so to my fellow social workers, I would say, yeah, as it's been said already, that social work itself is quite challenging when we take those new challenges and we want to become part of, you know, we are supposed to be agent of change. Then we are placed in the system. We are following our, you know, standard of practice. We are working on interdisciplinary teams. So we are interacting with other professionals. Not only that, but also we have policies in place. So some of us more than, depending on where we work, but I assume all of us, we are faced with almost similar challenges to, you know, to exert what we want to do, and also and try to, you know, try to break some of those, I would say, those policies and procedures. It is possible. There are times when it feels like, no, it's not impossible. The journey is not easy. It can be very frustrating, at times demoralizing. You know, people are questioning you, and then you internalize that. You know, it's so easy to start questioning yourself. But keep going. Don't give up. It's very important to just you know, be part of that, you know, the you know, that advocacy part of that, you know, the big system. Make those changes. Change is possible and change is hard. This is what I want to say. So stand your grounds.
Thank you so very much. Jordan, I invite you to share some final words of wisdom and reflection and call to action.
I'd just like to take a second just to thank Generous Space Ministries who initiated this project. Yes, a religious-based organization that's affirming of LGBTQ people initiated the project. They closed in June. Simon Fraser University stepped forward and supported the project over the summer months while the Community-Based Research Center renegotiated the funding with the federal government and got it and more, and hired me to continue the project till the end of March. So thanks to all those organizations that have been so supportive of the project. I think a really important piece that I haven't stressed today that is so critical is the disconnect and the polarization between religion and the LGBTQS two-spirit community. There's very good reasons for that. We all know that. But we also need to not make conversion therapy survivors feel, if it was experienced in a religious-based context, to not feel stupid or weak for having participated in conversion therapy. That is really, really important. Queer and trans people are people of faith. They are agnostic, they are pagan, and they have every experience of spirituality across the board. I want to leave you with two of the greatest barriers and challenges that survivors experience. One is not recognizing the harm that they've experienced. Second is dealing with the ongoing pressure to change or deny their gender or sexual identity. And lastly, the two advocacy supports needed include resources to help people understand that small, subtle statements to change or deny are just as harmful as blatant statements and pressures. And lastly, we need a greater awareness that non-faith-based SOGIECE or conversion therapy is equally as insidious as faith-based.
Thank you so very much. I appreciate that as well. And Lisa, we are going to have you share some final reflections, words of wisdom, advice, call to action.
Well, I think I feel quite humble offering words of wisdom following all the previous speakers, because, you know, I think all of what has been said needs to be amplified and is so important for working towards wellness in our communities. So, you know, I'm not a social worker, but I've been around a lot of social workers a lot of the time. And I do know what an important role you have in the system. I'm so excited that the college is doing this work. And I'm hoping that I can, in some way, support the work of the community in Nova Scotia and gain and, you know, see some gains in mental health and physical health and otherwise as well. So
thank you. Thank you so very much. I appreciate each and every one of our amazing speakers. I will be following up with you all as we look at developing policies, guidelines, and standards of practice for social workers so that we don't unintentionally, or God forbid, intentionally cause harm to our clients. And also this comes specifically as part of our Social Justice Committee's series that is entitled Big Ideas in Mental Health, Conversations about Important Topics. And we had a panel earlier that was focused on Indigenous mental health, where we've got some specific to homelessness and mental health, as well as another one coming up on African Nova Scotian mental health, many others that we are planning and organizing. Some of the members of the committee are here and probably getting some ideas, but the larger vision for our Social Justice Committee and really our college is a recognition that mental health is not a biological component that can just be solved with a pill, that mental health issues are really the reflection of larger social justice issues, and that the intersections of social injustice and inequity and colonialism and racism and misogyny and all of the other forms of oppression that exist as very real forces in our world and in our society impact the mental health of all of us, and that the larger issues around poverty that were also mentioned are all part of the justice that we need to be working towards. We have an upcoming advocacy day where we are going to be working collaboratively with other community organizations. I will be reaching out to our panelists as well as all of our members, and especially also our student social workers who are just learning what it means to be a social worker and how they can work to not only do no harm, but hopefully do good as well. So this is the start of hopefully a much larger conversation. I want to thank all of you for attending, and especially our speakers. Thank you so much. Hopefully, while this is a really short moment, hopefully it has inspired us to become aware of how much more we don't know, and we can take that and learn and dive deeper in how we can best serve the public and work towards justice. So with that, thank you all so very much.